Chairman Yu. I'm an associate professor at the Department of Management and Marketing at Bridgewater State University, and also a coordinator for Asian Studies program. Welcome to this China Town Hall meeting in Bridgewater, and thank you for participating in this event. This is sponsored by Munich Institute for Global Engagement and Asian Studies. Asian Studies is a minor program, studies program, and we sponsors activities, cultural activities, social activities, and academic activities each year. China Town Hall is one of the important ones we sponsor each year, co-sponsor each year. And this year, we are very fortunate to have the national webcast of Ray Dalio, a very famous author, a best-selling author, and also a financier or a founder of Bridgewater Associates. I wish that I have a book that he can sign, but is I've always want to do that, because when he was here last year, now 2 years ago at Harvard, I attended that conference, but couldn't get close to him. And so the Bridgewater Associates is a very famous asset management firm in Westport, Connecticut. Unluckily, not in the Bridgewater town of Massachusetts. And people always ask me, oh, Bridgewater Associates? And I said, no, Bridgewater State University. And but if I have, opportunities, I really wish that, my students of Asian Studies could get, internship opportunities or work opportunities there. That'd be great. And because they are the Bridgewater Associates focus on Asia and global a lot. We are also fortunate to have a local speaker. We have a national speaker, we have a local speaker. And Elena Uretsky from Brandeis University. She's associate professor of international and global studies and good researcher. So I'd like to invite Dr. Wing-Kai To for the brief introduction. And Wing-Kai To is Dr. Wing-Kai To is the founding coordinator of Asian Studies and my predecessor. Now he has become the founding assistant provost for global engagement, so moved up. Now, we are going very, he's going to give a brief introduction. Professor Elena Uretsky.
Well, thank you, everyone. Thank you, Dr. Yu. Thank you for everyone for attending this event. This is our 6 years of holding China Town Hall with the National Committee on U.S.-China Relations. Usually we have a talk from 6 to 7. Tonight we're very honored to have Dr. Elena Uretsky from Brandeis University. And she's going to speak about the benefits of health diplomacy during the age of a pandemic. And of course, it's all we talk about this year, apart from the election, right? So when we think about China and the pandemic and the election, they all, come to floor this year. And when people talk about China, and so we wanted to find a speaker who would speak about public health in China. And Dr. Uretsky is an expert on public health in China, and she got her PhD at Columbia University, and she did research. She's a medical anthropologist and a specialist in public health and global health, gender and sexuality, with a book on the HIV/AIDS in China called Occupational Hazards, Sex Business, and HIV in Post-Mao China. In the last 4 years, she has continued to do research on public health in China and published public health policy in China as well. So without further ado, let's welcome Dr. Uresky. And she'll speak for about 35 minutes. And after that, we'll have about 15 minutes for your questions. And so if you want to write your questions on the chat, you're welcome to do that. So, Dr. Uresky.
Thank you so much, Professor To, and thank you, Professor Yu, and everybody for inviting me here today. We've hosted Chinatown Hall events at Brandeis. This is our third year. This is the first time that I have the honor of being the local speaker, and it's really, really, really an honor to be able to speak to people who care about China, about my little sliver of China that I think is important. There's so many important things when it comes to China, because China is really, you know, one of the most important relationships that we have in the United States. And I'm going to talk. I want to talk a little bit about what the epidemic has looked like in China. Compare that to what the epidemic has looked like in the U.S. and even Massachusetts. And then look at, you know, lessons that China learned historically, and lessons that I think we could learn, and we could that could benefit us in this country. The coronavirus epidemic broke out in China in early December 2019, and really by April they got ahead of it, got on top of it, and today people walk around the malls, they go into restaurants, they travel, all really without concern. And there's so much that we can learn from China, and still we're going into the winter at a point that we've not seen in this country yet. So I don't think it's too late. I think there are still things that we can learn. So let me see if I can share this screen. Can everyone see that?
Yes.
Okay, good. All right, so if we look as recently as 2 days ago, they're almost, if I were to look at this now, it would probably be up to 51 million cases of coronavirus confirmed globally, with around probably almost 1.3 million deaths worldwide. And this truly is a global pandemic that has spread to 214 countries around the world. China has accounted for 91,000, almost 92,000 of those 50 million cases. It's accounted for a little over 4,700 deaths of the over 1 million deaths. This is sort of when we look at epidemic curves. This is what the epidemic curve has looked like. It started in early. You see it growing here, starting in mid-January, and then by the time you get to mid-April, that curve has flattened, and it hardly grows from there at this point. So in the United States, we've just surpassed 10 million cases. We're somewhere around 238,000 deaths. We've tested 156 million people, which is not nearly enough. And this is what our death curve looks like. From mid-January until now, continuously rising, and really there's not much of an end in sight. In Massachusetts, we've seen a total of 166,000, almost 167,000 cases. Actually, probably by today, it's well over 167,000. Close to 10,000 people have died in Massachusetts, and we've tested around 7 million people. Again, not nearly enough. And it is still incredibly difficult to get tested in Massachusetts and many states in this country. In fact, everyone in my family was tested today. We think we may have been exposed to COVID. My husband and I are lucky enough that we work at a university where we can just walk in and get a test for free. We had to find a place to get a test for my kids, and it's not cheap at all. So it's really out of reach and not accessible. So if we look at, some of the countries around the world, there are varying rates of COVID. The mortality rate also varies greatly. Anywhere from Belgium has one of the highest mortality rates from COVID of any country at 114.3 deaths per 100,000 people. In the US, we're around 72 deaths per 100,000 people. India, which has an explosive epidemic, is recorded at 9.36 deaths per 100,000 people. And we've heard a lot about countries like South Korea, Taiwan, and China that really were able to get in front of the epidemic. So Taiwan at 0.3 deaths per 100,000 people, and China at 0.34 deaths per 100,000 people. If we look at how the epidemic is developing in some of these countries, again, Taiwan, China, South Korea, have been doing relatively well, but still, cases, there are new cases. There have been 19 new cases in Taiwan over the past week, 268 cases in China over the past week, 821 cases in South Korea over the past week, all the way up to the United States, where there have been 761,000 cases over the past week. And if we look at sort of how testing is prioritized, and this comes from early on, this is a graphic from early on in the epidemic, but it's an interesting graphic that shows us, sort of the number of tests performed relative to a country's population. And again, this is early on in the epidemic. There is more testing available in the United States now, but still it's really not as accessible as it should be. And you can see this inverse proportion that goes from the US to South Korea, where testing has been widely available in South Korea. Testing is made widely available in China. We heard just a couple of weeks ago of a small outbreak in Qingdao, which is northeast China, just southeast of Beijing. There was a small outbreak, and the entire city of 9 or 10 million people was tested. And that's how you bring these outbreaks under control. So from my perspective, as someone who studies public health in China and someone who really started my career studying public health in China just before the SARS epidemic, I started setting up a dissertation project in 2001, 2002, and I eventually went to conduct the fieldwork for that dissertation project in September or October of 2003. Wondering whether my university was going to let me, go to China to conduct research. So SARS is sort of it's a big inflection point in my career as a public health researcher in China. And I, along with a lot of my colleagues who studied public health in China and were living in China during the time of SARS, I looked at the coronavirus epidemic back in January, February, as something that would be another SARS-like story. I started calling it SARS 2.0, and really believed, along with others, that it would start and end quickly, and then it really wouldn't have an impact, very much of an impact outside of China. So this is what things look like during the SARS epidemic. The first cases were recorded in November of 2002, really without anyone noticing. By February of 2003, the WHO got a phone call from the embassy in Beijing of a rumor of a strange contagious disease in Guangdong in southeastern China. By late February, the WHO had been asking to come into China. By late February, China allowed a WHO team to visit Beijing. And it really wasn't until March that the WHO was really allowed to investigate what was going on. By the end of March, there's a widespread outbreak of this disease that is by then called SARS. We issued a travel advisory to China. The WHO issued a travel advisory for Hong Kong and Guangdong. And right here we are, April already, and the WHO is allowed to actually make visits to the areas where the epidemic is breaking out. At which point the Chinese government realized they actually needed to deal with this epidemic. They could no longer cover it up. It was something they had to deal with. It had been declared a public health emergency of international concern. And by May, they had gotten on top of it. There were quarantines issued for Beijing. People were quarantined in their homes. And by June, the WHO removes Beijing from its list of affected regions and lifts the travel advisory. And by the early July, SARS is declared as under control. And we've really never heard much about it since. And it was assumed that SARS was gone. So juxtapose that to what's happened in the past 10 months. So here was an epidemic that showed up in the beginning of December. Again, no one really knew what it was, but it was a SARS-like virus that was showing up in the hospitals in Wuhan in China. By January 3rd, really, as the Chinese government realized that this was of concern, they notified the WHO of SARS in China. And a week later, they released the genetic data of this novel coronavirus. They sequenced the genome and released the data to the rest of the world and published it in The Lancet. By January 20th, there's an official declaration of human-to-human transmission. January 23rd, right around the time Chinese New Year is about to start and millions of people are about to start traveling around China, the Chinese government this time doesn't only quarantine people in their homes, but they locked down an entire city of 11 million people and subsequently locked down other cities within the province. Over 50 million were locked down in cities, and people were told to quarantine at home. So everything is happening a lot quicker. The Chinese government is much more transparent in this case. And the WHO is allowed to declare a public health emergency of international concern within 2 months of the diagnosis of the first known case. By the beginning of March, the number of cases in China is falling to less than 20 per day, suggesting that the outbreak had been largely brought under control in Hubei province. And it's the next day that the WHO declares COVID-19 a global pandemic. And a month later, Wuhan is able to lift a 77-day lockdown just as we're going in sort of, stay-at-home lockdowns, and we're looking at the number 77 days and saying to ourselves, wow, 77 days, that's a long, there's no way that would happen in this country. We'll be back to work, we'll be back to school, back to class in a couple of weeks, back into restaurants. And here we are 8 months later, and we're doing this over Zoom today because we can't do it in person. So what did China do? How did they get on top of this so quickly? Well, they figured out how to control the source of the infection. They made sure that people were quarantining at home, and they centralized the isolation of patients who were confirmed positive, or people who were presumed positive, or anyone with symptoms or close contacts. So, in this country, in most places, if you are confirmed positive or presumed positive, you're sent home to isolate at home with your family. You expose others to the disease. What is they built these huge field hospitals. And anyone who was confirmed positive or presumed positive was put into a field hospital. They were allowed to isolate. Thereby, they were taken out of the community and able to protect the community. When they locked down Wuhan, this was thought of as something really, really draconian. They locked down an entire city. They blocked all outbound transportation from the city. They stopped public transit and, ride-sharing services like Uber. They made mask wearing compulsory. They limited social gatherings immediately. And they were asking people to quarantine at home. And this was done by January 23rd. And it was a centralized, coordinated type of response. The government instituted policies of centralized quarantine and treatment of all confirmed and presumptive cases in these designated field hospitals. That included people with fever, respiratory systems, or close contacts of those people. And they instituted a stay-at-home policy for all residents in the city, and people were highly monitored. And this is something that you can do in an authoritarian country, yes. But I think there's also a sense of collectivism that lives within the Chinese culture and within the Chinese population, so that people said, okay, we understand this is what's necessary, and we'll do this. And I also think that there is a sense of a need to prioritize public health in China. And this is something that they learned from SARS, right? So if we look back, right, to the SARS epidemic and sort of the slow moving response to the epidemic, this was a response. The pace of this response was governed by the party's interest in politics and protecting the economy, and so they covered things up at first. They had a very, very weak public health infrastructure in China in 2003, and they realized that this was one of the reasons why this epidemic was able to break out. And so after the SARS epidemic, they really focused on their public health system. They strengthened their public health system. They made sure that people were, that the people who are working in the public health system were trained professionally and properly in public health. If you look at the chief epidemiologist for the CDC today, who was the chief epidemiologist for the National AIDS Program for a long time, he's a He's a UCLA trained epidemiologist, trained under Roger Deedles, who's one of the foremost epidemiologists in the country, with a postdoc at Yale. And many of the people who work in the CDC in China are trained by him or have come through the same programs that he was trained through at UCLA and Yale. That's who works in the Chinese public health system, in the Chinese CDC today. That was not the case before 2003. They also developed one of the most comprehensive and advanced surveillance systems in the world, so that when an epidemic like the current one breaks out, they can track it. Contact tracing is also something that China has valued and prioritized since the SARS epidemic. For anyone who's flown into China since the SARS epidemic knows when you fly in, you fill out your immigration form and your quarantine form. And if, during the H1N1 epidemic, if there was someone on a plane who came down with a fever, that was then reported, and every single person who flew in on that plane was notified that they should be cautious and vigilant over the next couple days. And so there's really, really, rigorous contact tracing in China. And so it's, that gives them the ability to trace the epidemic, to track the epidemic, and to give people back their lives. I actually learned from a student of mine in class today who's in China. She has, probably every person in China has what's called a travel passport. It's a program on your phone. It's not an app, but it's a program on your phone that gives you the ability to travel or not, depending on where you've been. So she just came from Shanghai to the city of Changsha, and she can, because she was in Shanghai and there's recently been a small outbreak in Shanghai, she can't stay in hotels in Changsha. She can't go on planes or trains because her phone will show up red when she pulls up this program. And it's a way of, of sort of limiting the transmission from Shanghai to other parts of the country. So, these are ways that China blocked transmission and continues to block transmission. They cordon off cities, they suspend public transportation, right? They prohibit intercity travel, they close public places, and they make sure that there's centralized distribution of necessities that people have, right? Food and drugs. Right, so that also the compulsory wearing of face masks, the promotion of hand washing, ventilation, self-monitoring of body temperature, right, and these compulsory stay-at-home orders and universal symptom surveys by community workers and volunteers. These are things that a lot of us do maybe at our places of employment or at schools, but this is not something that's compulsory for people in general. And this is what can result from a centralized, coordinated public health response that is run by a government that I believe prioritizes public health. We've seen, and we've seen this not only in China. This is not only something that's possible under an authoritarian government. We've seen this in Taiwan. We've seen this in South Korea. And, I think if we have to boil this effective response down to a few recommendations, we can boil it down to preparedness, swift and rigorous action, testing, treating, and tracing, and effective communication. And if anyone looks at the Taiwanese response to the coronavirus, they were ready. They've been ready since SARS broke out. After SARS, Taiwan established a National Health Command Center with a branch that focuses specifically on outbreak response. When the coronavirus broke out in in China. They brought a lot of Taiwanese nationals back from China. They started restricting flights from Wuhan. They began screening passengers from Wuhan. And they activated their Central Epidemic Command Center, which allowed them to coordinate the responses from their various ministries and enact policies and strategies that had been put in place after SARS. They started daily press briefings. They started regular public service announcements about travel and personal hygiene. They started producing masks and not exporting them. They had everything in place, and all they had to do was mobilize it. And here, right, you see what the effect of that is. A carefully constructed plan and a prioritization of public health is what has helped Taiwan, again, sort of stay on top of this, and has made me envious of looking at my friends who live in Taiwan and get to go out and travel and breathe the air and eat in restaurants and live the way that I always enjoyed living. So I'll stop there, and I'm happy to take people's questions, and thank you for listening.
Oh, thank you so much for this informative and comparative presentation that established a lot of facts and at the same time opened our eyes to look to our situation in the United States. And I would, before I open it to our participants, I would like to ask two questions. One is, how can you address this widely spread, opinion that China knew about the virus way before December, and they tried to cover it up? It's just similar to what happened when they have that with the SARS. The second thing is, what kind of collaboration that the Chinese government can do in terms of handling the situation in the United States, aside from the politics, because there are a lot of lessons to be learned from the experience in China.
Thanks, those are great questions. I do know that a lot of people suspect that or blame China for covering up this epidemic before they revealed what was happening. And there are people who still doubt that, the numbers that are being released from China are true. From what we know, right, this started sometime late November, early December. It was a virus that no one had ever seen. It was a novel emerging virus. And, all the doctors who were seeing it knew was that it looked something like SARS. But what was it? They didn't know. I think this is a virus that has acted slightly differently than SARS. The symptoms are different. The rate of infectiousness is different, and the mortality rate, thankfully, is much different. SARS, the mortality rate from SARS was about 10%. It wasn't as infectious a disease, possibly because it killed off its host. But, so when you have a novel emerging virus, it takes a while to figure out what's happening. For doctors and hospitals who are seeing something that they haven't seen before, it's very, very difficult, for them to diagnose it. I think we can see that in this country, even, if you walk into a hospital with a tropical disease because you've come back from, somewhere in Africa, it's very difficult to get that disease diagnosed because no one's ever seen it before. So imagine how difficult that is for a newly emerging virus. And then there was a lot of political jockeying. If this is going to be released to the world, who does it? Who has the authority to break this to the world? The city? Certainly not a municipality at the level of a city, and not even a municipality at the level of a province. So first there's that jockeying between the city and the province that has to happen, and then the bureaucratic jockeying that goes on with the center. China it's a bureaucratically complex country. It is a vertical authoritarian government, and yes, I think that has to be worked through before you can come forward to the international community to say, yeah, this horrible thing is happening in our country. And that, unfortunately, is, that's the impact of bureaucracy. Maybe they've learned, but just like they learned from their mistake, with public health in 2003, maybe they've learned some, new lessons this time. In terms of collaboration to handle the situation in the US, I wish there was a way for us to collaborate more. Certainly there was a failure and a void in US-China collaboration that may have led to the emergence of the epidemic. We had a much stronger, a much more robust public health presence in China before the Trump administration. We had 12 public health officers stationed in the embassy in Beijing, and we had over 40 Chinese people who were employed by the US CDC, who were sort of field officers. And that shriveled down to about 3 public health officers and maybe 12 field officers by last December. And so our ability to coordinate with the Chinese public health system, something that really helped to detect and pick up emerging infections, that was shriveled up by last December. And I think there's so many lessons that we could learn from China, and I think it's not just political. I think there is a general mistrust of what Chinese scientists do in this country, right? We've seen a lot of plagiarism in Chinese journals. We've seen a lot of things that we don't like. There are a lot of good things that happen in Chinese science as well. But I think our trust has been broken by, sort of the bad things that we've seen. There have been, I think, individual anecdotal instances where US doctors and US hospitals have learned from Chinese doctors and Chinese hospitals. There are a lot of Chinese American doctors who work in this country, and they've been in touch with their friends and colleagues back in China. There's been a lot of, sort of personal networking where doctors have been able to learn lessons. There was a great article in the Philadelphia Inquirer, I don't know, 6 months ago or so, about lessons that the Temple University Hospital learned from hospitals in Wuhan. And they were able to restructure the flow of traffic through the hospital based on what they learned from the hospital in Wuhan. But to do this on in a coordinated fashion on sort of a larger scale has proven to be very, very difficult. And it actually, I had actually worked on creating a network of Chinese doctors and American doctors at one point, so that they could trade experiences, and American doctors and healthcare professionals could learn from Chinese doctors. And what I learned was that there was a lack of trust that was preventing the American doctors from listening to the Chinese doctors. So it's a really hard nut to crack.
Thank you so much. I have 2 questions. James, are you available to read your question, ask your question, or to read it?
Yeah, sure. I can read the question.
Yes,
Dr. Uretsky, for your slides and information. The first one has more to do with regulations. So, whatever the source being, where the virus came from, laboratory, wet markets, animal storage, have there been any type of regulations since China either isolated or is figuring out from Wuhan where these things may be coming from? And then secondly, you're obviously bringing up Taiwan and, other Asian countries. New Zealand and some other countries have been very effective as well. Are there similar measures that the US can, take from those other than the ones that you've covered? So, contact tracing, testing, treatment, things along those lines. Thank you.
Thanks for your questions. So the regulations that I know that have been imposed, they shut down that wet market in Wuhan pretty quickly. I mean, that's one of the challenges with China is that, we talk about the rule of man over the rule of law in China. After SARS happened, there were regulations placed on the sale of animals in wet markets. It can prove difficult to enforce a lot of these regulations. I think because of China's sort of fragmented system of governance. China is a vertical centralized system of governance on paper, but oftentimes, what we see in practice is that it's actually very, very difficult for the center to control what goes on in the provinces, and that's because there's been a lot of fiscal decentralization since since the mid-'80s. So the center is not funding what happens in the provinces. And so the provinces really don't feel as if they have to listen to the center on a lot of sort of soft issues. There are hard issues like the one-child policy, which is now the two-child policy, economic development. Those are hard issues that are used to to evaluate the performance of local officials, and they pay attention to those policies. But a lot of the softer issues, they feel they don't have to pay attention to. So, policy is one thing. Implementing that policy and making sure that policies are adhered to are another thing. So your second question, control measures, are control measures similar? Are there control measures similar as in non-Asian countries with lower rates, such as New Zealand? I think what they've really relied on is testing and tracing, right? Mask wearing is basic. But testing and tracing and quarantine, they're basic, they're basic public health measures that they're, it's nothing new to anybody, right? We talk about this term social distancing as if it's a new term. No, it's a term that was, that was used 100 years ago, during the Spanish flu epidemic. And they're not highly technical. They're very, very simple. They don't cost a lot, and they're basic and fundamental to controlling a disease like this. If you fly into Taiwan, you will be quarantined for 2 weeks. And in many countries, you'll be quarantined for 2 weeks. It's so, and there are apps that, sort of follow people around. And so, if you come within 350 feet of where, someone infected with COVID lives in Singapore, your phone starts beeping to let you know that, you're within a certain proximity of someone who's infected. And so, there's vulnerability there. I think, I think if we could adhere to these basic measures, we'd be fine. We don't really need anything fancier than that.
Thank you.
Thank you. Okay, I have another question. Yankee, we want to go and ask your question, please.
Yes, thank you very much for your presentation. I'm just wondering why many pandemics originate in Asia or Africa, such as, SARS and COVID-19 from Asia, and Ebola and yellow fever from Africa. Is it related to rapid urbanization? What else?
That's a really good question. I'm not a zoonotic disease specialist. Rapid urbanization definitely has something to do with the spread of pandemics, but not with the origin. One of the things that's really interesting for me about this pandemic is that, they found the origin in horseshoe bats in Yunnan, that live in a cave in Yunnan province. The plague also originated in Yunnan province, around the 13th century. A lot of what causes the spread of epidemics like this is global migration. The plague in the 13th century, one of the reasons why that always interests me so much is because the plague originated in the same place where I did my field work, on the Burmese border, and it was rats. There were rats that sort of hopped on to burlap sacks of opium that were being transported out of Yunnan province. They come from Burma into Yunnan province and were being transported out to the rest of China. It's just, so Yunnan is an incredibly diverse area. It is the meeting point of, the meeting point of many different zones. So you find an incredibly diverse array of flora and fauna in Yunnan. There are several avian migration routes that meet there. It's the meeting point of the 3 major rivers in Southeast Asia. So it's just an incredibly diverse environment. So it doesn't surprise me that, there could be the presence of such disease there. But it's also, it's sort of the origin of a lot of migration routes as well.
So what the thing that you would highly recommend to use or to imply or to utilize? This comes from one of our participants, that the US may use and then control this pandemic.
We need to test and trace. We need access to testing. Again, this is not new. This is something that I do research on HIV. This is something that we've been talking about with HIV for years. The sort of most highly trained, experienced immunologists in our country figured out years ago that if we could test people for HIV and let them know their serostatus, then they would know that they could potentially infect other people, and they would, hopefully choose to protect others around them. If we don't know our serostatus, then it's really difficult to know whether we should be going out and interacting with other people, which is why we're all shut up in our homes and why we're sitting here on Zoom today, because this is a virus that doesn't always show itself.
Okay.
Up to 40% of cases that are transmitted are asymptomatic. So it is imperative that we get access to testing.
Thank you. I will send it to our host, Chen, and then to closing remarks from Wenkai. Chen? Mute.
You're muted.
You're still muted. Yeah, okay.
Yeah, okay. Thank you very much for your presentation, and we're very informative, and we've learned a lot, not only about the coronavirus, but also the SARS that I have been to personally. I was there in July with a study tour group, and with Americans. We have temperature testing. So this is very interesting and very informative, and we have a few minutes, and then we will, have connected to our national webcast. So Dr. Wikato, and you have some final thoughts or words?
I think it's really a critical time in our history because the infection rate over the last week nationally is similar to March and April when we first went into the pandemic. So it's really discouraging when we think about, 8 months from the pandemic now, from March all the way to November, we're going back to we have not really moved the needle. So, we are all in a period of very profound uncertainty, both in terms of the future of the pandemic and how we get a hold of it. Despite the news about the vaccine, and we all know that it's going to take some time for this to go over that. But we do need people like Dr. Ureski and other public health faculty in different universities and in the media to continue to exert pressure on the administration to adopt measures that will encourage people to follow the guidelines and try to wear a mask, have social distancing, and improve on the testing and contact tracing that we have. I feel that there's a middle ground between, monitoring everyone's action and movement, and to some of the old-fashioned method of just calling people up to do phone bank and contact tracing. So I feel that there are many states that could actually have done a better job in contact tracing and isolation and quarantine, so that we really put the numbers down. I was a little bit discouraged when we thought that we will only have 300 cases in Massachusetts, back in September, but then it went back up to over 1,000. So hopefully this will improve with the new administration and with the new team. But I really think that this goes beyond politics. We need the whole country to have a sense of purpose, to have a sense of urgency, so that we can all get over this in the months to come. So that's the important issue, not just about China, but also about the United States. But obviously, China gives us a good model to think about. If we all do it together, we can keep this under control.